Sleep apnea may increase the risk of heart disease and even Alzheimer's. Many people don't even realize that they have it, yet it could be silently damaging their bodies every single night. We are joined today here by Dr. Chauncey Crandall. He is the director of the Palm Beach Clinic of Preventative Medicine and Cardiology, and he's also the author of Heart Health Report, a monthly newsletter that was helped hundreds of thousands of readers prevent and even reverse heart disease. Dr. Crandall, welcome on to Newsline.
Thank you, John.
I certainly do not get enough sleep. I know that for a fact. It's shocking to hear what I just read, is that could be doing some serious damage. Dr. Crandall, you warn that poor sleep can raise blood pressure, cause irregular heart rhythm, and increase the risk of heart attacks. How exactly does your poor sleep, put such strain on the cardiovascular system?
Well, John, you're right. The body needs oxygen, and when you have poor sleep, you don't get oxygen. And two of the organs that need a lot of oxygen are, one, the brain, and two, the heart. So what happens as people become obese or overweight, we call this obstructive sleep apnea. Their tongue is bigger, the back of their throat changes. And when they go to bed at night, they snore, and they snore a lot. And you can hear this in the other room. And it's a problem for many people because if you have a partner, the partner has to sleep in another bed. But over time, this snoring and the decreased oxygen that is floating around the body creates a problem. It can give you high blood pressure. This is one of the things. Your body starts screaming for oxygen when you stop sleeping. No different than when you're swimming underwater in a pool and you need oxygen. The body is behaving, and what happens? The blood pressure starts going up, inflammatory factors start going up. The brain has a lack of oxygen. It starts changing over time, and it can have long-term effects that will hurt you in the long run.
Very interesting. I know when I snore, I get a sore throat, but studies suggest, though, that sleep disruptions, they can lead to some memory problems and cognitive decline over time. Could untreated sleep apnea contribute to Alzheimer's, maybe some other forms of dementia?
Well, it can, and the reason for that is that lack of oxygen can change the brain. It can interfere with memory, and this can also create inflammation. We know that Alzheimer's or dementia, many of it is inflammatory induced, and this is one of the problems with sleep apnea. So if someone has a problem, they need to get evaluated. And we can treat it, is the good news. And so there are treatments for this, and weight loss is probably the biggest thing, the best thing that people can do if they have this disorder.
Doctor, I imagine a lot of people don't even realize that they have sleep apnea. What are some of the warning signs to look out for? Who's most at risk for developing this condition?
Well, the people that are most at risk are people that are overweight. We call this obstructive sleep apnea, but other people too, people that are on heavy medicines or narcotics, things like that can interrupt your sleep cycle. The elderly can have this. That would be called more like central sleep apnea. But the warning signals are lack of sleep, tiredness throughout the day, restlessness during the night, loud snoring, of course, and even a change in personality can be an indicator that you have sleep apnea. So talk to your doctor, review it with him. There are ways that we can test you for this through the office. And once we make the diagnosis, we can give you treatment.
I do see a lot of commercials for sleep apnea. There's also a lot of treatment options out there for sleep apnea, from lifestyle changes to, you see those CPAP machines. But what are some of the most effective ways to manage and reduce the risks of this serious sleep disorder?
Well, the main thing, John, is to lose weight. If you're overweight, this is the best thing you can do. The other is sometimes this can be positional, the way you're sleeping in bed. So changing from one position to another will help. Other things, exercise, ideal body weight, better diet will help you. But if it really is sleep apnea and you cannot lose weight, you can have a treatment that's called CPAP. You have to wear a mask. It's uncomfortable. It's not the best thing to go through. So there is a lot of motivation for you to change your lifestyle and improve.
Absolutely, and you can start today. Dr. Chauncey Crandall, thank you so much for coming on and shedding all the insight on it. Appreciate it. While the long-term effects of insufficient sleep can be harmful, especially for the heart, Sleep to Heal, 7 simple steps to better sleep will support you on your renewed journey toward better sleep. Get this book and Dr. Crandall's Heart Health Report with a free offer. Call or go online. Check it out right now.
Information, truth is freedom. Is Newsmax. It's real news for real people.